Welcome back. Yes, and show is interactive. Use the hashtag Breakfast Daily on all social media platforms. The WhatsApp line is 0550-585832. Yeah. Today we're going to be talking very important conversation. One of those conversations that people find like it's better they don't mention it because it's happening, but we'd rather not talk about it.
Yeah, bury our hands in the sand.
Yeah. But it exists and it's real.
It does.
It's a challenge, and we're going to find out from Dr. Kelvin Owusu how much of a challenge really is it in our space.
Yes.
Dr. Kelvin Owusu, good morning.
Good morning, David.
It's good to have you here.
It's good to be here. Good morning, Kokui.
Good morning, Doc. Good to see you.
Same
as
here.
always.
Same
always
here.
Looking sharp. Sharp.
Thank you. Oh.
Okay, so we're having a good chuckle, but we've got serious business to discuss today.
Yes, we do.
And as Kweku said, it's a topic that a lot of people don't like to broach because of the taboo and stigma associated with it. Yet, people are doing it every day.
Oh, they are.
And it's abortion. That's what we're talking about today.
Yeah.
We'll talk about what medically is described as an abortion and what the law also says about abortions in Ghana. And Kweku will have some insights on that as well. Okay. So, yes, what in medical terms is considered an abortion, Doc?
Well, so simply put, it's a termination of a pregnancy before the period of viability. Now, that's very, very, very important, before the period of viability. Now, every jurisdiction defines that period of viability. For us, it's 28 weeks. So, yes, before any termination of pregnancy, whether it is by natural causes or by artificial causes, once it happens before that period of viability, then we call it an abortion.
So, in Ghana, the period of viability is 28 weeks?
Yes.
That's pretty far along.
Yes, that's about 7 months.
7 months
yes.
almost. Yeah.
I mean, elsewhere they come to about the earliest is about 21 weeks. Yes.
Okay.
So the point is, beyond that period of viability, what we are trying to say is that baby would have survived if he or she was given a chance.
Right.
So if you did an abortion beyond that point, you are literally classified as murder.
Right.
Okay.
But before then, there's there are loopholes.
Gray areas,
gray areas you can use to justify your decision to have an abortion. That's provided it's an artificial intervention.
Okay.
Now we have this discourse in our country where there's, I mean, as far back as I think it was, for me, it was the 90s when I first saw some documentaries on, the original premier station, the TV station in Ghana, and talking about quack doctors and all of that. What's the extent of proliferation, as far as in your practice, what's the extent of proliferation of places and spaces where people tend to go to for abortions as opposed to coming to regular hospitals?
I mean, so let's take it back a bit. How many people actually are aware that you can actually go to hospital and get a proper abortion done? That's if you have made a decision that you're going to go for an abortion. How many people actually are aware that you can actually get it done in a hospital by a qualified medical practitioner?
That's a good point.
You see, that's the first issue.
Yeah.
And so
because of that, should I say, lack of information, a lot of people tend to go to all other areas, in fact, anywhere you can imagine, people are doing abortions. We don't hear about it much these days, I guess, because everybody has sort of, like Kokui said, we don't want to talk about
Buried
it.
their head in the sand.
But I mean, in my experience, I've seen some very, very, very weird post-abortion complications.
Wow.
One classic example that I witnessed personally. This was a couple of years ago, I admit, but this was in the Volta Regional Hospital where I was doing a rotation in Ops and Gynae, and a young lady, teenager, about 17, 18, comes in very septic, very ill. Physically, you couldn't find anything wrong on the physical surface, but a history of pregnancy and attempted abortion. And then you take a peek down there, and there's a stick. Yes, there's a stick. So so they had actually poked the stick through the vagina, and he had gone through.
Kill the baby.
Well, they were trying to abort the baby. I mean, that's how desperate they were. So there was actually a stick that had been, attempted to bring the baby out, and they what happened was that a splinter was left behind, and that splinter had now become a source of infection. So this girl was very, very septic. You know, she was close to death. That's how bad the situation was. You know. And people, this was obviously not done by a health practitioner. So some quack person with no knowledge about whatever is going on decided to put some concoction on the stick and push it up there. And once they saw blood, it's been successful, you know. And it's the story of a lot of women, a lot of girls, I must say, you know, because of the lack of information, you know. And so it's a big deal. It's a big deal. Then comes the social media era where there's a lot of information available online. So people also now pick bits here and they think they know, so they just walk into a pharmacy, and unfortunately there's a lot of laxity when it comes to our pharmacies and chemical you know, so they just go and they mention a certain common product and then they get it off the shelf and they think they've done a good job, only to realize that they are either still pregnant or they've had an incomplete abortion, which there are various types of abortion. There's an incomplete abortion and they end up bleeding with severe pain, and if they don't now end up in hospital, there's a problem.
Okay. Now we'll delve further into the incomplete abortion and then, you know, the different kinds of abortion that there are. But we want to talk about the legality of all of this, right? Now, I had a conversation with a lawyer, private legal practitioner, Divine Doche Tete. Let's take a look. All right, now we want to speak to a private legal practitioner regarding the whole issue of abortion as far as our constitution, which of course is the guiding document, is concerned, as far as all our legal, you know, discourse is concerned in this country. And we've been joined on Zoom by Divine Doche Tete. He is a private legal practitioner. He's going to help us to get into this conversation. Now, Divine, good. Welcome to Breakfast Daily.
Yes, David. Thank you very much. How are you?
Very well, thank you. All right, so let's situate this conversation right in the middle of the Constitution. What does the law say as far as abortion is concerned?
All right, thank you. Well, this is regulated by Section 58 of the Criminal Offences Act, Act 29. So it stipulates that subject to certain specific conditions or exemptions, abortion or miscarriages are illegal or unlawful. In fact, what is stipulated is that both the lady that allows herself to undergo this process and the person that is also inducing this, such that there is going to be abortion or miscarriage, both of them commit an offense. And this offense is what we lawyers term as a second-degree felony. So, but then there are certain sections within law. One of them is where, for instance, the pregnancy is as a result of rape, for instance, or defilement.
Okay.
So, but the caveat here is that this process must be performed by a recognized medical practitioner.
Okay.
So it's not for the lady in her own accord to say that because it's as a result of rape, I can go ahead and take any drug or any substance to induce abortion or to cause miscarriage. It must be performed by a private legal practitioner who is authorized to do so. Now, aside that, there could also be circumstances where the pregnancy in itself may be injurious to the health of the lady.
Okay.
So if it's not removed, the lady or the child would end up dying. So this is an exception within the confine of law, because the law, the framers of our law anticipate that there may be circumstances where the pregnancy in itself could pose a risk to the life of the mother. So that is one other exception. But again, let me reiterate that in all of this, it's important that a medical practitioner, preferably someone who is specialized in gynecology, undertakes the act. So it is not at all lawful for an individual who is not qualified to consume anything with the attempt or the hope of inducing miscarriage or committing abortion.
Okay, but one would argue from what you've said that by and large, within certain limitations, it's pretty much legal.
So when you say within, so there are exemptions to that provision.
Okay.
And So the exemptions is so that when you go according to those exemptions, then it makes it illegal.
Okay.
So we can say that in the broader sense, it's illegal.
Okay.
But when the exemptions, you follow those exemptions that I have stipulated,
okay,
and it's performed by a private legal practitioner specialized to do so, then you can say within that context, what you are doing is a legality.
Okay.
But if that is not followed, then it's illegal.
All right. Fantastic.
Well, yes.
Okay.
So so you can't have a broad brush argument and say that it's illegal. It is illegal, but there are exceptions that have been stipulated in our law.
Okay.
Yes.
Okay.
Such that yes.
Do you find also, does the law clarify as to the timings? So, for example, if the age of the fetus is, let's say, 9 weeks compared to, let's say, 12 weeks or let's say 16 weeks, is there any breakdown of that within the law? Does the law, give that in any form of LI or article at all?
The law doesn't stipulate how old the pregnancy should be. That is why the framers of the law, in their sense, wants a medical practitioner.
Okay.
Because once a medical practitioner is involved, then the medical practitioner can tell whether or not this abortion is safe or unsafe.
Okay.
Because it's only the medical practitioner that can tell,
right.
not any other person. Yes.
All right. Divine, I want to say a big thank you to you for joining us this afternoon and joining us on the segment and helping us to understand exactly the details as far as the law is concerned. We really appreciate your time. Thank you.
You're welcome, David, and thank you for having me.
All right. So that was Divine. All right. So that was Divine Ndoche Tete, who is a private legal practitioner, giving us some perspective on what the law says as far as abortion is concerned. So, broadly, it's illegal, but there are, contexts within which a private legal practitioner, I say practitioner, the same thing that he was saying, wasn't it? A medical, a professional licensed medical practitioner can
indeed
conduct this. All right. So you're talking to us about different types of abortion.
Yes. Yeah. So I mean, there's the spontaneous abortion, which is popularly called a miscarriage.
Okay.
So usually when people say miscarriage, they're referring to a spontaneous abortion, which means that something either wrong with the baby, or something wrong with the mother, or something wrong with the way the two of them are relating in the womb, makes the environment not conducive for the pregnancy, and so that pregnancy is expelled by the body. So it happens, and in fact, it's actually most women actually lose pregnancies without ever realizing that they were pregnant in the first place. It usually happens within the first 3 months. That's the first trimester. It can happen a bit beyond that, but it's usually precipitated by something natural in quotes. So it could be ill health on the mother's side or the baby side for that matter. So we have baby factors and mother's factors. It causes spontaneous abortion. So that's the first type. Then of course there's the induced abortion, which is the termination of pregnancy through artificial means, either by taking medication or going through surgical procedures to remove the baby. So that's also there. Then either of these two, spontaneous or induced, can result in an incomplete abortion. Where portions of the fetus is left behind. So some portions have come out, other portions remain inside. And in which case you need some form of surgical intervention to remove the remainder of the fetal parts from the womb. If you don't do that, the remainder, because it's dead, would become a source of infection, and that can cause it can cause significant damage. In fact, most of the post-abortion complications are usually because some fetal parts were left behind, which became septic and could result in the removal of the womb entirely. Because if you don't do that, then there can be fatal complications for the mother as well. Then we also have a situation where we have threatened abortion. Yes, and a threatened abortion is where due to one or two reasons, there might be instances, especially in the first trimester, where a pregnant woman might notice some bleeding, And once you notice bleeding coming, per vaginum, it means that there's something threatening the pregnancy. That threatened pregnancy or that threatened abortion can resolve itself, and then everything returns to normal. Usually we recommend bed rest, because the truth of the matter is that if that baby is supposed to come out, for instance, if there's a problem and the body is rejecting it and you insist on keeping it, you might have problems with the baby in later on. So we don't necessarily intervene. We just allow. The best recommendation is to rest. Of course, we need to rule out whatever else could be the cause. If there's an infection of the mother, for instance, we'll treat it. Malaria is one of the commonest causes of actually miscarriages. Malaria.
Wow.
So infections in general, malaria, stress. So we remove those stresses, and then with the bed rest, hopefully, if it's meant to stay, to resolve itself, and then you can continue that pregnancy. If it wants to come out, you can't stop it. You have to let it come out. Then we have an inevitable abortion, as the name suggests. So if there was a threatened abortion which then started to progress, if the cervix has now opened, so usually when it's a threatened abortion, the cervix is still closed, but there might be some bleeding escaping. So if you do an examination, the cervix is closed, then it is a threatened abortion. But if you did an examination or in the course of the bed rest, you notice that the cervix has opened, there's nothing you can do. It's inevitable. So at that point, you can either leave it to come by itself, or you can assist it to come out by itself. To come out, not by itself, to assist it to come out. So that's an inevitable abortion. So those are the various types of abortions.
Now, Doc, for a woman who's looking to have an abortion, especially again because of the stigma, because they fear judgment and all of that, they might not feel comfortable walking into an established health facility to get that service done. Which is why a lot of women end up going to these quacks or taking concoctions that they shouldn't be taking. How are the hospitals set up, to the best of your knowledge, for women who are seeking that kind of service? Do they just walk to their GP and ask for it? Is there a designated place where they can go and be semi-anonymous, or how does the system help women who are seeking this without making them feel like they're going to be judged at the end of the day, or they're not in a safe space?
You see, so the mere fact that they even have to be semi-anonymous itself, it tells you the cultural aspect of this whole discussion, But yes, when it comes to the hospital setup, so let me take it from this angle. So there are two kinds of hospitals generally. There are the faith-based hospitals, and there are the regular Joe hospitals, or should I say regular Kofi hospitals. So most of the faith-based hospitals, most of them would not actually perform abortion services
for religious reasons.
Especially when it comes to the one that what's it called, by choice, the choice of the woman, they would most likely not indulge in it. But as a doctor, we are not supposed to have an opinion. So we are neither pro-life or pro-choice. We are doctors. We are in the middle. We are supposed to go with whatever the patient decides. But of course, we also work in a system. So assuming I'm a doctor working in a faith-based facility where the facility does not allow for the performance of these services, as a doctor, it is my responsibility, it's my obligation to then counsel the woman. First of all, is the woman sure that that's what she wants to do? Maybe they don't know that there are other things, there are options out there. So counseling is the first thing. So after the counseling, if the woman is cocksure that this is what I want to do, then it's my obligation to refer to a facility where the service can be rendered. And there are facilities that are actually properly set up. The should I say the mother facility is Kolibu. So Kolibu actually has an entire unit which is like properly set up unit where you can actually go. It's called the family planning center. You can actually go, just walk in. You don't even need an appointment. You can just walk in, and their staff are properly trained to actually handle this. There's absolutely no judgment. It doesn't matter what age you are, whether you are a teenager, it doesn't really matter. You can actually walk in and then have a proper counseling done, and then following which, if the decision is made, then the procedure is carried out. And the post-procedure counseling is even more important, because you see, abortion is not the family planning method.
Right.
No. It is not.
It shouldn't be.
Exactly. So you cannot go about having 2, 3, 4, 10 abortions. It doesn't even make sense. And so everybody who has gone through an abortion, especially by choice, is always counseled about family planning following that procedure, so that if there's a need to put in an IUD or to have an implant or to have an injection, it is done, so that you're not going to come back again for an abortion. You see, it's very, very important. And there are other hospitals also set up properly, so you just need to, the thing is, every GP is equipped to counsel regarding abortion. So you can actually just walk into any GP, and like I already mentioned, if they cannot perform it at their facility. So for instance, if you came to my facility where I work right now, in my department, I am into wellness. So if you came to me right now, I can't perform an abortion because I don't even have the tools to perform an abortion.
Right.
You know, but it is my responsibility to then refer you to the colleague who is in the same facility, who's in a different place, who can actually do it, or refer to a hospital that can actually have it done. You know, and sometimes, of course, it's a bit difficult to also separate personal from professional. So some doctors, you know, they themselves, even though they are obligated to do it, may be reluctant in doing it. But like I'm saying, I'm stressing on the fact that they are obligated to still refer. If the woman has said that this is what needs to be done, you know, you have to refer to some place that they can actually get it done. It is important.
Very important.
Fantastic.
I know. There's so much more we can
It's
learn,
good to
but
know.
yeah.
Yeah, even a facility like Kolebu has been set up for this, and people can just literally just walk in the family planning unit. It's called the family planning.
Yes, family planning unit. I mean, the thing is, it's actually a woman who wants to terminate a pregnancy will go through whatever it takes to terminate that pregnancy. So it's better you actually do it properly, so that woman can still have and safely, so that she can enjoy a quality of life, than to watch her go and put a stick up there and then you know, come in, because see, they'll come in, they can't even afford the theater space, but you can't also sack them, so you're still going to do that operation, and now it becomes a problem who's going to pay. So you might as well intervene when it's cheaper and it's safer to get that pregnancy out of the way, than to wait for the complication and try to deal with it. You know, so it's really a chicken and egg situation. Where do you tackle first?
See you, Doc.
All right, thank you very much.
Thank you.
This with us. How can people get in touch with you if they want to find out?
I'm active on social media, Kelvin Owusu MD, so on all channels, and you can also follow my clinic page, Claron Health International, and you can ask all the questions you want to ask.
All right,
Awesome.
thank you.
Thank you, Doc.
All right, we'll take a quick break. Don't go anywhere. We'll be right back.